So I say good morning, welcome to the webinar. It's going to be recorded for attendees. My name is Patricia McCrory and my role is as a member of the NICP network is to inform health stakeholders regarding Horizon Europe health opportunities. We have around 90 people registered for today's event, representing all the different sectors, academic, industry, some of the hospital trusts, policymakers. We've representatives from the north of Ireland and south, so a very warm welcome to you all. This is a quick overview of today's agenda. As I say, we're starting now with my quick welcome and introduction, and then we'll move on to a number of talks from UK NCPs for Health and the Irish NCPs for Health. We will have a case study of Horizon 2020, hints and tips, sort of to acknowledge what might be good practice going forward for Horizon Europe. We will then have a talk on European Innovation Council for the NCP for SMEs, followed by a pitch session towards the end of the event, sorry. And I'm going to finish off with a quick run through of some funding opportunities under Pillar 1, Marie Skłodowski-Curie actions and European Research Council, as well as a quick overview of support for applicants. So as I say, welcome everybody. We really appreciate you coming today and appreciate all our speakers being online. So now I'd like to invite Katie Dingley, UK NCP, to present her slides, and Katie is going to be followed immediately by Joe Frost, the second UK NCP for Health, joining us today. So Katie, the floor is yours now. Thank you.
Thanks, Patricia. Good morning, everyone. I'm really pleased to be able to speak to you today about the opportunities available for health and biomedical research funding in Horizon Europe. I'm the national contact point for health, mainly for academia, and I'm based at the Medical Research Council at UKRI. So first this morning, I'll give an overview of Horizon Europe and explain about the UK's continued participation, and then move on to the funding opportunities available in the health cluster. Horizon Europe is the latest EU framework programme which funds international research and innovation activities. It's the successor to Horizon 2020, which is finished last year and will run until 2027 with a budget of at least 95.5 billion euros. The image here shows the structure of Horizon Europe. It is very similar to that of Horizon 2020 with the three-pillar structure, with pots of money across all of these pillars that you can apply for funding from. Pillar 1 focuses on excellent science. Pillar 2 on global challenges and industrial competitiveness. Pillar 3 pulls together innovation activities. And underlying the programme is widening participation and strengthening the European research area. My main focus today will be the health cluster in Pillar 2 and the opportunities available there. And the budget for the health cluster is at least 8.3 billion euros, and it funds a wide range of health-related research, which I'll run through now. And I'll also cover another couple of opportunities for funding for biomedical research. But first, why apply for EU funding? So to highlight the opportunities available, I just wanted to draw your attention to the UK's success in securing health research funding under Horizon 2020. UK organisations were awarded 791 million euros, which was 15% of the total budget. And the heat map shows the levels of funding awarded to each country, highlighting the UK's success. Looking towards the future with Horizon Europe, 8.3 billion euros of funding for the health cluster is available, and this is likely to increase once contributions from associated countries are included. Along with the funds available, you are able to work with a range of potential collaborators, including in other associated countries and many low and middle income countries, and also participate in European partnerships and in response to the cancer mission, which I'll cover at the end of my presentation. I understand that some of you may have questions about UK access to Horizon Europe, so I just wanted to explain that the UK will continue to participate in Horizon funding. At the moment, the European Commission has published a Q&A document confirming the UK's eligibility, and it details that UK entities will have the same rights to participate as EU countries. The funding rates will be the same, and the UK can also lead projects. You may have seen the emergency coronavirus variants calls earlier this year. UK entities were eligible to apply to them and are now partners in 6 of the 11 projects that were funded. Then in the coming weeks, we expect the UK to formally associate to Horizon Europe, as agreed in the Trade and Cooperation Agreement last year. Association isn't a new process, and a number of countries have participated in this way in the past, including Norway and Israel, who have both been successful in receiving funding. To quickly run through what this will mean, UK entities will have equivalent participation rights to those from member states, with only the 2 very rare exceptions explained on screen. Firstly, the equity fund part of the EIC accelerator, as the UK decided not to take part in this. And secondly, very occasionally work programme level exclusions may occur, but we're not aware of any of these in the health cluster. So this means that UK entities can lead projects as coordinators. UK experts can continue to take part in peer review, which is a great way to see proposals and learn about the evaluation process. And the UK can also participate in the governance of Horizon Europe, for example, programme committees. The MRC represents the UK on the Programme Committee for Health, and so will continue to contribute to shaping future work programmes. I'll now move on to the funding opportunities for health and biomedical research across the health cluster, and also briefly cover the cancer mission and opportunities in other clusters. At the core of the health cluster is its work programme, which is a document that details all of the core topics for 2021 and 2022 across 6 destinations or research themes, including their budgets, scope, and expected outcomes. The destinations are staying healthy in a rapidly changing society, living and working in a health promoting environment, tackling diseases and reducing disease burden, ensuring access to innovative, sustainable and high quality healthcare, unlocking the full potential of new tools, technologies and digital solutions for a healthy society, and maintaining an innovative, sustainable and globally competitive health-related industry. I'll now run through the core topics available in each destination for 2022, as the 2021 calls have already closed, and I've linked to the work programme on the slide so that you can explore any specific calls that you're interested in more detail. In Destination 1, there are four core topics for 2022. The first is focused on understanding that the role played by social and environmental factors in mental health, such as climate change or the COVID-19 pandemic, and they're linked to the development of interventions to promote well-being and prevent mental illness, including in the most vulnerable populations. The second on the list is focused on the use of artificial intelligence to predict the risk of NCDs, seeking proposals for the development of proof of concept or feasibility studies to validate the AI tools for risk assessment of disease or disease progression, including the development of adequate performance metrics. The third topic centres around the prevention of obesity, supporting research into considering biological, socioeconomic and behavioural drivers of obesity, identification of biomarkers, and the setting up of pilots for management strategies. The final topic funds work on chronic inflammation, and proposals are expected to develop and implement data-driven, personalised approaches to identify the drivers of chronic inflammation that may determine the transition from health to pre-symptomatic and early stages of chronic diseases and disorders. Continuing with Destination 2, The 2022 core topic supports activities which should improve the calculation of the socio-economic costs and or benefits of health impacts associated with environmental stresses, including the development of innovative tools and models and the delivery of an open knowledge base. Destination 3 in the work programme is focused on reducing disease burden. The first core topic supports research into the next generation of immunotherapies in order to improve and diversify the healthcare capabilities for a range of diseases. Proposals here are expected to include the preclinical development and study of new immunotherapeutic agents, first in human studies, the production of safety assessment frameworks, and the development of uptake and access pathways. For the next core topic, proposals should aim to diversify and accelerate the global vaccine research and development pipeline. The core will support the innovation and integration of expertise and capabilities from discovery to late-stage development, including reverse vaccinology, innovative vaccine manufacturing approaches, and evaluation of alternative vaccine delivery routes. The final two-stage topic supports research into the development of therapies for rare diseases with no approved therapeutic option. Proposals from multidisciplinary groups are encouraged and should focus on groups of rare diseases with commonalities and will develop innovative clinical trials designs and novel approaches to monitor the effectiveness and safety of proposed interventions. Moving to the single stage cores, the first topic will support research activities in preparation for the next pandemic. In the scope of this topic will be research focusing on pathogen X from threat assessment, horizon scanning for the identification of potential medical countermeasures and innovative technologies, including the development of standardized research protocols. The next topic is focused on implementation research about common risk prevention interventions to reduce the impact of non-communicable diseases in both low and middle income countries and high income country settings. It is aligned with the Global Alliance for Chronic Diseases 2021 core, and proposals should focus on implementation science around evidence-based interventions that promote healthy behaviours and that have the potential to profoundly reduce the risk of chronic diseases and multimorbidity. Proposals for the next topic in this call will support the global collaboration and coordination against the threat posed by new or emerging infectious diseases and should include the provision of strong scientific and organisational support, information management and communication, and facilitate the work of scientific advisors and working groups. The core topic at the bottom of the slide is related to a partnership, which you can find more information about in the work programme itself. For Destination 4, the first two topics in the 2022 set are slightly different to typical Horizon Europe cores, as they are both focused on procurement in the field of innovation in healthcare systems. So if you're interested in either of those, please do feel free to contact me afterwards for further advice, as they do have some special requirements. The third call here tackles the challenges of financing healthcare, supporting research which covers new evidence-based and socially equitable approaches to financial planning, whilst improving health inequalities, and the development of access tools for healthcare professionals and providers. Again, the final topic is related to another partnership, which you can find more about in the work programme itself. Destination 5 is centred around the importance of technology as a key driver for innovation in healthcare. For the first topic on this slide, applicants should perform the clinical validation of qualified biomarkers that will enable the identification of appropriate patients to ensure an effective and efficient use of existing pharmaceuticals in the treatment of major diseases and conditions. Projects should use the concept of personalised medicine, and it's important to note that it only includes medicines already on the market and not the validation of biomarkers for the development of new medicinal products. The topic also excludes cancer and rare disease treatments. The middle topic here aims to address the need of health regulatory bodies and health technology bodies across the EU. Proposals should develop standardised processes and methods to access real-world data and/or synthetic data to move towards a standard data quality framework, enhance the performance and efficiency of large randomised clinical trials, and new models of clinical trials. The last topic on the slide, computational models for new patient stratification strategies. Here you can use a broad range of solutions such as computational disease models, computational systems medicine approaches, machine learning algorithms, and digital twin technologies. And finally, the first topic for Destination 6 in 2022 supports proposals which help to strengthen cybersecurity, maintaining the performance of medical devices while preserving or enhancing safety, security, and data confidentiality, integrity, and availability. Applicants should tackle the cybersecurity issue of connected medical devices and diagnostic medical devices, in particular those that are connected to the internet, allow remote access to data, and exchange private data too. For the second core topic, projects are expected to support the development of innovative, unbiased, AI-based and distributed tools, technologies, and digital solutions, while maintaining a high level of data privacy. This may include improving de-identification techniques, develop innovative anonymization techniques, and explore the techniques for creating synthetic data. Projects should also ensure wide uptake and scalability of the methodologies and tools developed. Projects for the middle topic here should propose new value-based pricing and reimbursement models that can help ensure equitable access to effective, efficient, affordable, and sustainable health technologies, including medicines, while supporting innovation and industrial competitiveness. The fourth topic supports activities that bring together different actors working on innovative digital health solutions to reinforce their collaboration exchange and efforts on scaling up digital health solutions across Europe. Proposals should encourage a people-centered approach that empowers citizens and patients, and it is a requirement to integrate them into a European digital health smart innovation hub, which will serve as a European reference platform for scalable digital health solutions, both for public organisations and private actors. The final topic is for establishing a European health record exchange format ecosystem. The EU has supported projects to ensure cross-border sharing of health data, and in 2019 adopted a recommendation on the European Electronic Health Record Exchange Format ecosystem. There is a need to continue supporting the uptake of new cases, like lab results, medical imaging and reports, and hospital discharge reports, and incorporate new requirements and stakeholders. That brings us to the end of the Health Work programme. I appreciate it may have been a lot to run through quite quickly, but I have linked to the current programme on the slide, which you can then read in more detail for any detailed topics that you might be interested in. I'm just also going to quickly cover a couple of related areas with opportunities for health funding, the first of which is the Cancer Mission. European research and innovation missions are new for Horizon Europe, and they develop a moonshot approach to research with the goal of delivering measurable solutions within a set time frame for some of the greatest societal challenges we face today. The European Commission has launched 5 of these missions, one of which is on cancer, and aims to improve the lives of more than 3 million people by 2030 through prevention and cure, and for those affected by cancer to live longer and better lives. The next steps will be for the Horizon Europe programme to provide €378.2 million in the period 2021 to 2023 to support the implementation of the mission, and we expect work programmes to be updated shortly. The implementation of a strategic research and innovation agenda to improve both the understanding of and treatment for cancer, improved quality of life for patients and their families, and develop collaboration within the cancer community, supporting a network of comprehensive cancer infrastructures, setting up the EU platform understandingcancer.eu, and creating the European Cancer Patient Digital Centre. And finally, although my focus today was in the health cluster, I would also encourage you to look in the work programmes of other clusters too, as highlighted here on the slide, as they also contain many core topics that have health elements. Unfortunately, I can't cover them all today due to time constraints, but I have linked to a longer webinar and slide set where you can find further information. I'll now pass over to my colleague Jo, who will cover project types and how to find partners.
Hello everyone, so I'm Jo, the other UK national contact point for health, and me and Katie have a newsletter. If you'd like to sign up to that, the link's on the slide. So first of all, I wanted to include a slide on the European Commission's definition of different types of project used in the health cluster and also the rest of Pillar 2 of Horizon Europe. When you're putting your consortium together, it's worth bearing in mind these definitions as they might influence your consortium design. As you can see on the slide, the research and innovation actions are activities primarily aiming to establish new knowledge or to explore the feasibility of new and improved technologies, products, processes, services, or solutions. And this can include basic or applied research, technology development and integration, testing, demonstration, and validation of small-scale prototypes. Innovation actions are aimed at producing plans and arrangements or designs for new, altered and improved products, services and processes. And this can include things like prototyping, testing, demonstrating, piloting and large-scale product validation and market replication. And then coordination and support actions are not normally doing research, but can be some other type of activity such as road mapping or a policy study or organising an event. The coordination and support actions typically involve policymakers, governments, regulators, and research funders. There's some more info on these project types in the general annexes to the work programme, and I've included a link to that on the slide. So I'd suggest you have a look at that. On Katie's slides in her table, she had which project type each of the core topics was as well. So the next important thing for building a consortium is the eligibility. So Horizon Europe will fund any type of organisation, including companies and universities, established in EU member states or associated countries. And there's 18 countries in the process of associating, including Norway and Israel. It also funds organisations from around 115 low and middle income countries. It funds international European research organisations like the European Molecular Biology Lab. And you can also get funding to work with high income countries occasionally, but this is only if it's specified in the call topic or if it's essential for the project. One important thing to notice, and this just applies to the health cluster, it doesn't apply to the rest of Horizon Europe, is that US organisations are funded apart from the CSA, Coordination and Support Action project type. So organisations from other countries which are not on the top part of my slide can participate too often, although they would have to fund their own participation. So often there's national contact points in different countries around the world who can advise if there is local funding available for them to join Horizon Europe. And also the European Commission will sometimes publish country profiles online. Just to note as well, Switzerland did associate to the previous framework programme and isn't currently discussing the association for the current one. However, the Swiss government will fund their organisations to take part in projects, so you can work with Swiss organisations too. The minimum consortia size for collaborative projects like research and innovation actions is to have 3 independent legal entities established in different EU member states or associated countries. And a new rule for Horizon Europe is at least one of them must be based in a member state. So you can't just have 3 associated countries. For coordination and support actions, the minimum is 1 or more legal entities in a member state associated country, or if it's mentioned in the call text, it can be in another country. However, these are the minimum project sizes. Normally, we have quite a few more partners in projects. Once you've reached the minimum, you can also add partners in the same country or different countries. So, for example, if you have a university in Northern Ireland, you can also go into a consortium with a company in Northern Ireland, as long as you meet the minimum requirements on the slide. So if you're thinking of building a consortia, what do ideal partners look like? Well, you need to think about who you'd like to work with. You should aim to build a consortia where everyone is expert in their field. And if you don't already know potential partners, then check them out carefully. For example, look at their website and publications and previous experience in collaborating in EU or other projects, and have a Google. And it's important to work with people who are enthusiastic but also committed. Applying for and running an EU project is a big commitment. So people need to be willing to put in the time into preparing the proposal and running the project if you're successful getting funding. You need to work with people who'll be responsive to the coordinator when you're building the proposal and during the project. And you'll be working closely with your partners for a few years. So it's important that you have good relationship and mutual trust. So when you're starting to build a consortia, you need to think about the expertise that's needed for the project. You need to read the core topic carefully. For example, think about what sectors and disciplines are needed. Are you going to include academia, industry, patient groups, policymakers, for example? You might want to start thinking about who you've worked with before, or who you might know with suitable expertise. And don't just think about this from a personal point of view. You can also think who in your institution has links to other people, and you can think about who the people you know might already have links with. Sometimes people think it's a safe bet to work with people they've already worked with before and know that they have a good working relationship with. However, most Horizon projects need an interdisciplinary or intersectoral approach. So it's likely that you'll need to look at other partners outside your usual circle of contacts too. You need to think about what expertise is needed and where you might find good partners with this knowledge. And on the next slide, I'll explain some mechanisms you can use to find partners. In addition, you can look online to see who's taken part in important events and conferences, stakeholder groups and consultations in your area. You could also look at patents and products and academic papers to see where the leaders are in the field. And think about how people will be involved in the project. Some organisations might be partners in your consortia, but you can also have people involved in different ways, for example, on advisory groups feeding in or groups that you disseminate to. And think about the European added value too. If you haven't heard about this concept before, then normally the EU will only fund projects in Horizon Europe that cannot be done by one country alone. So the projects have to have a cross-border angle. For example, you might need data or infrastructure in different countries, access to different cohorts or health systems, for example. You might be tackling a problem that goes across borders, like the spread of disease or managing migration, or you might be doing something to support policy work at EU or global level and trying to have an impact in different countries. And personally, I think it's quite good to try and find some partners or organisations in your consortium who've experience in EU funding if you can. For example, big universities might have support staff who are very familiar with the processes and rules. So there's some consortium building mechanisms that you can use, and I'll show you some of these online in a moment as well too. So first of all is the EU participant portal. Each call topic has a web page where there's a partner search section where you can upload a profile, and you can also look at the profiles of others. You can also attend brokerage events where you can find out who's interested in the same call topics as you and arrange to meet them. And you can upload information on you and your organisation and the topics you want to work on. So there's a brokerage event for the 2022 health calls coming up soon on the 29th of October. You can already register for that and see who's interested in the different topics and arrange to meet them. And I'll show you that online in a second as well. Some other organisations have partner search tools and databases, for example, the Enterprise Europe Network or Innovate UK Edge in the UK. And also the Innovative Medicines or Innovative Health Initiative has its own partnering tool as well. You can also use the partnering tool within the How to Participate tab on the Funding and Tenders portal. One of my favourite ways to look for partners is to look at a website called Cordis, which has lots of information on previous EU projects and who's participated in them. It might be that these people are applying again for similar core topics, but obviously if they've been successful in getting funding before, they're likely to be good partners. So you might need to sell yourself to them and explain why you'd like to join their group or you'd be good to work with. So I'm now just going to share my web browser so I can show you some of these things. Okay, so first of all, we've got the call page for one of the call topics, mental health in Europe and times of change. If you scroll down, you can see there's a partner search section. And if you click on that, you'll see some information like this, where you can see organisations that are interested in participating, what country they're from, what kind of organisation they are, and if they're offering expertise or if they're seeking expertise. People seeking expertise might already have a consortium, but just have a missing aspect they're looking for. So you can go and put your information there and look who's there. This is the Cordis website that I mentioned that has information on previous projects. So you can filter on the left. I've picked projects here and I've picked the EU's most recent research programme, Horizon 2020. And then you can search in the middle. If you search for AMR, for example, there's 89 previous projects that are listed, and you can find out some more info about those by clicking on them. So here's one about analysing breath. It tells you what the objective is, and on the right-hand side, you can see when it started and finished. At the bottom, you can see which organisations are involved in the consortium. This is led by a company in Wales, this one. And very importantly, at the top right, there's this little symbol where my mouse is, and that takes you to the website for the project. And on that website, for example, for this project, there's often a contact section, or you can find out information about the consortia. You can maybe contact them if they've done a similar project before and see if they're interested in applying again. The final thing I wanted to show you online was the webpage for the brokerage event on the 29th of October. So you can already register for this at the top right of the page. And within the website, you can navigate to the Participants and Marketplace tab. As you can see, it has the list of call topics down the side. You can see there's 265 people interested in the first call topic here, and you can see the profiles and click on them in the middle for more detail. So I can see there's someone from Dublin registered here, for example. So that's really useful. I'm just going to go back to my slides now. I've put some screen prints in the slides, just that you've got those for reference, but I'll skip over them and move on to my final few slides. So we also have a partnering form that NCPs use. You can contact us if you'd want to fill this in, and we can send it round to other NCPs in other countries. We also plan to put some of this information in our newsletters or maybe in an online folder. So sign up to our newsletter to stay up to date with that. On the slide, I've also put a link to the Commission Info Day on the health call topics on the 28th of October. That's a chance to ask the European Commission questions if you have them on the topic. There's no need to pre-register, and the presentations will be available online afterwards as well. There's a link to the partnering event that I just showed you on the web browser, and this is not announced yet properly, but there will be another partnering event we're organising on the 26th of October with some other UK organisations, including the UK Government Office in Ireland. And this is to encourage partnering for the particular topics listed on the slide, as well as the Joint Programme Initiative for AMR, which is going to have a call on therapeutics. And we expect the details of that extra call on therapeutics to be announced on the 18th of November. The Joint Programme Initiative on AMR is like a separate pot of money, which uses some money from Horizon, but other countries also put money in. So that has its own funding rules. So once the documents are available for that call, if you're interested in that, you'll have to check the call details to see the full details. So this slide has some tips on what constitutes a winning team. Firstly, and most importantly, you'll need a team that can deliver the expected outcomes that the European Commission has stated in the call text. And you need to convince the evaluators that you can do that and that this will be within the budget. There's no typical or model consortium structure or membership. It depends on what's needed for the topic. And as I mentioned, any types of organisation can be funded by Horizon Europe. So it's common to see universities and big and small businesses working together, also with research and technology organisations and other organisations like local and national authorities or patient groups, charities and policymakers. So you can have a mix of those within a consortia. It's also useful to include exploitation partners, someone who's going to take the outputs of the project and implement them and show good immediate impact. For example, from policy, industry, hospitals, patient care, for example, and some health topics require patient groups to be involved. You don't necessarily need to include everyone as partners as well. You could include the end user community, possibly as an advisory board or associate partners, in which case you could use money in your consortium to cover their travel costs, for example. You can explain in your proposal how they will feed into the design of project and make sure that the work you're doing will meet the needs of the stakeholders. And also you can show that they're a route to having an impact. So I think we've got a slide on this later as well, but just in case anyone misses the end of the presentation, there's also a UK call announced recently where people can get up to £5,000 to help build consortia. This can fund organisations in the UK, but also fund their potential partners in the EU and other eligible countries, included associated countries, low and middle income countries, the US for health and Switzerland. So there's a link on the slide if you want more information about that. So that's it from me. Thank you.
Thank you very much, Joe and Katie. Two great presentations. I forgot at the beginning of the call of the webinar to sort of highlight to people, if you have any questions, please pop them into the Q&A box, and we will have a Q&A slot after. There's going to be two more presentations and then we'll have a Q&A session. So please pop your questions into the Q&A. And we also have the chat box there if anyone wants to share their details to the wider group of attendees. So now I'd like to invite Kay Duggan-Walls, who's the Irish NCP for Health, to share her slides. Kay is going to talk about Horizon Europe novelties in comparison to Horizon 2020. So Kay, the floor is yours.
Thank you, Patricia, and thank you for inviting me to speak today. I'm going to talk about the changes from Horizon 2020 to Horizon Europe. So I'm the NCP in the Health Research Board in Dublin, and I work alongside with Martha Cahill, who is speaking after me, and Martha works in Enterprise Ireland. And we also have a newsletter, and I think Martha will probably give details of that as well in her presentation. So some of the novelties that are in Horizon Europe, first of all, there are new fields in Part A that weren't there before. There's a researchers table, and this is needed to follow up for research careers and how the funding is affecting researcher careers. So it's one of the Horizon Europe indicators that the European Commission will be evaluating the programme on. And here, you're not to include people who are not researchers. This is just for researchers. Then there's also the role of participating organisations will have to be specified in Part A. And there's also a self-declaration on gender equality plans. Now I'll talk about those further on. So this is in Part A as well. Then some fields were moved from Part B to Part A. And this is the ethics self-assessment is now in Part A. This is a security questionnaire, and this is new in all Horizon Europe proposals, not just in health. And then there's also information on participants' previous activities related to the call. This used to be in section 4 and 5 in Part B, and now it's in Part A. And then there's also in Part B, there's a glossary of definitions which has been added, which is very useful because you will understand what the different definitions are that the Commission talks about. There's addition of detailed explanations on what is expected and what should be included in each section, which is also very helpful to guide you along as you're putting your proposal together. Social sciences and humanities and interdisciplinarity and gender aspects are strengthened in the excellence part of the template. And in the template as well, there are 3 sections, and these correspond to an evaluation criteria. Each corresponds to an evaluation criteria. Then when it comes to evaluation, the number of aspects to be taken into account is being reduced, so ensuring that the same aspects aren't assessed twice. Open science practices are assessed as part of the scientific methodology in the excellence criterion and under the quality and efficiency of implementation. Open science was previously part of the impact criterion, so now it has moved to the excellence criterion. Then a data management plan must be provided for the research data results and they have to be in line with FAIR principles. And also there's a new approach to impact in Horizon Europe, and they're looking at key impact pathways. And I've included here a link to a webinar run by the European Commission on how to write a successful proposal. And here they deal in detail about the key impact pathways. It would take too long to go into it now, but applicants need to think about the specific contribution that their project can make to the expected outcomes and impacts that are set out in the work programme. And the impacts are set out in the strategic programme. So the 6 destinations are actually the impacts. And the template is very good guidance also on how to deal with the impact section. And there in section 2.3, there's a summary table which helps you explain how your project will contribute to impact. Then, as I mentioned earlier, there's the integration of the gender dimension into research and innovation content is now a requirement by default. Previous to this, it was encouraged that you would discuss the integration of the gender dimension into your research, but now it's in there by default and evaluated under the excellence criterion, unless the topic description explicitly specifies otherwise. And then the assessment of the quality of the applicants is assessed under implementation rather than as a separate assessment of operational capacity. And they've also removed the assessment of management structures, and this was done because the European Commission felt that in all applications now the management section is dealt with very well, and there's very good quality management structures in the application, so they've decided to remove that. And when it comes to the page numbers, there have been a number of changes here as well, and they have been reduced dramatically. As you can see, for the research and innovation applications, for a full application, it's now 45 pages when it was previously 70. For coordination and support actions, 30 pages, and that was previously 50. For program co-fund actions, the limit is now 70 pages. And then for the first stage of a 2-stage application, that's down to 10 pages. So that's really very short, and it will require you to be very precise when you're putting your proposal together. And there will be an automatic warning and invitation to resubmit if you exceed any of the page limits. And in the part B, some parts have been merged to shorten the length of the proposal. For example, the objectives and ambition sections are now combined into a single 4-page long section. So I was saying I was going to talk about gender equality. So gender equality is a strengthened commitment in Horizon Europe, and there are 3 main levels at which gender equality is considered now in Horizon Europe. So having a gender equality plan in place is now an eligibility criterion for all public bodies, higher education institutions, and research organisations from EU countries and associated countries for proposals being submitted from 2022 onwards. And as we saw a few minutes ago, the integration of the gender dimension into research and innovation content is a requirement by default now, an award criterion evaluated under excellence. There's also increasing gender balance throughout the programme, which is another objective, and it's a target of 50% women in Horizon Europe related boards, expert groups and evaluation committees. And the gender balance among research teams is set as a ranking criterion for proposals of the same score. So the gender equality plan is an eligibility criterion, and for calls with deadlines in 2022 onwards, you need to have a gender equality plan. And it must be in place for the signature of the grant agreement. At the moment, you will sign that, that you have it in place, but by the time signature of the grant, then you must have it in place. And there's also details in the general annexes of the work programme as well to comply with the eligibility criteria. A gender equality plan must have 4 mandatory process-related requirements or building blocks, and I'll show you those on the next page. And here's a link where you'll find further information on all things gender, and the European Commission published recently a gender guidance, which will be on that website as well. So these are the mandatory requirements. It must be a formal document published on the institution's website and signed by top management. There must be dedicated resources committed to it and expertise in gender equality to implement the plan. And then there also has to be data collection and monitoring to make sure that you're following up. And there's annual reporting based on the indicators. And then training, awareness raising, training on gender equality and unconscious biases for staff and decision makers. So the final thing that I'm going to talk about is changes in the ranking criterion. And I've highlighted 2 here because, or 3 actually. Criterion number 3 is that the gender balance among the personnel named in the proposal will be one of the ranking criteria. And then number 4 is geographical diversity, and that's new, that wasn't there before. SMEs was there before, but that was along with, it was budget allocated to SMEs and then gender balance among the personnel named on the project. So it was the 3rd criterion involving SMEs, but now there's a very new one of geographical diversity, and gender balance is still at number 3. They're my contact details, and if you want to contact me on any aspects of Horizon Europe funding for health research, I'm available, and there's my contact details. And thank you very much for your attention, and I'd be available to answer any questions.
Thank you, Kay. Thanks very much indeed. And our next speaker is Anita Hogg, who's going to talk about Horizon 2020 and hints and tips for preparing a proposal for Horizon EU funding. Anita is based at the Medicines Optimisation Innovation Centre. So I'll pass on to you now, Anita. Thank you very much.
That's brilliant, Patricia. Thank you, and good morning, everybody. I'm really delighted to be able to share some of our tips and some of our experience. So I'm Anita Hogg, and one of the leads in the Medicines Optimisation Innovation Centre, and I think we've got a broad range of participants this morning, so there may be those who don't know who we are or what we do. So we've got a short clip that will explain who we are and what we do. So when we're thinking about our tips from MOIC, I suppose these are the 5 biggies, and I'm going to structure the presentation around this, and I really hope that everybody will get some really practical tips based on our experience. So what about finding partners then? We've heard a lot about finding partners to date from Jo, but I suppose in our experience it's very much about networking, and we have a long history of networking, and I would really encourage people to really get active in creating networks across Europe and even further afield. But it's also about disseminating what we are doing, telling people about who we are and what we do, because that's relevant to them and relevant to a lot of these calls. And also we do that through a range of conference presentations and speaking engagements, publications, papers, but also we have a well-established hosting program where people who are interested in our work can come and visit us in MOIC and spend maybe a day if it's a high-level delegation of decision makers and managers, or maybe for a couple of weeks if people would like to work shadow some of our staff, or even for a period of 3 or 4 months where people can undertake a short project with us and take that learning away. So very much about dissemination and who we are. And also it's about getting recognition for what we do and getting our name out there as a centre of excellence. And we have a lot of memoranda of understanding with different societies in lots of European countries, but also across some pan-European organisations like the European Association of Hospital Pharmacists. And we're also identified as a centre of excellence under the EAHP. They have a SILK programme. So people who are looking for information on medicines optimisation can come and visit us as a centre of excellence. So get out there, do the legwork and get yourself noticed. But it's also about creating your networks locally, because if we want to do projects, we have to have networks across hospitals, across healthcare generally, and with patient groups and also with charities. So create your networks locally. So what about identifying the call topic? You've heard some about this earlier on from previous speakers, but based on our experience, our networks are key to this, because often we have partners and networks contacting us if they've got an idea for a call or a project, and they will want to work with us. But do the legwork, get onto the portal and the website and see what calls are there, and don't wait for somebody just to call at your door. Do the legwork yourself. Also, people like Patricia is a fount of all knowledge, and it's about letting Patricia know who you are and what your skill set is. So if she hears of a call or maybe people looking for partners, she can connect the two. So what about writing the proposal then, the $1 million question? Well, I suppose we need to be flexible, because one size doesn't fit all, and it depends very much on the consortium as to what your role or my role would be. But one thing that we have learned, we would very strongly advocate using the skills of a proposal or a grant facilitation company, because they know the ins and outs of these grants, how to write, what to put in, where to put it, and they have an excellent skill set. So we have found that really invaluable. As has already been said this morning, get commitment from your partners up front, because if they're not going to commit at the proposal writing stage, they're not going to commit if the project gets funded. Be really good about getting dates and diaries and meetings that everybody commits to. They have to turn up with clear actions and accountability based on those actions. And if we're thinking about time frame, time just runs away, and it's maybe a sign of me getting older, but time just vanishes. Maximize your lead-in time, leave nothing to last minute, let there be no surprises. Make sure you have a Gantt chart. What are the deliverables? What are the time frames that you need to meet, so that you're leaving yourself enough time to get this put together and get it submitted? Be aware of other pieces of information that will be necessary. So for example, if you're not a university, you may not have a PIC number. That's a participant identification code that needs to be found. And if you need information on that, you can contact Patricia. And also a really good tip is to get onto the portal and start populating the proposal soon. Don't leave that with a week or a couple of weeks to go. Get as much information in there as you possibly can. Make sure you know the spec of the grant, and again, that's been mentioned earlier on. That is a key building block. What are the requirements? And make sure that you align to that, because when you start writing the proposal, it is so easy to go up a different garden path or to get sidetracked. Always keep yourself bring yourself back to what those requirements are and align very closely to that. And make sure that you've got a strong consortium, as strong as you can, based on the past research expertise. And in one of our recent grant applications, we have had a WHO collaborating centre as one of the partners, which was great. Make sure there's a strong programme lead and also strong work package leads. And a piece of advice, what we did in our last proposal, because we weren't overly familiar with all of the various partners, we did a scoping exercise to find out what their expertise was, and so that they could be aligned with the best work packages in relation to their skill set. Make sure that you're up to date with what's happening across Europe, what's hot and what's not, what are the key topics, what are the key terminologies. We've heard about legacy and impact, also harmonisation. So be aware of what's going on across Europe. Make sure that you have clearly defined deliverables that you can absolutely deliver on. Don't over-egg the pudding. You need to be relevant and based on what your capabilities are. Make sure that you can deliver everything that you're claiming to be able to deliver. Also, whenever you've got a pan-European consortium, be very aware of some of the very big differences between the different companies and countries and organizations, because the structures, for example, in Estonia or Poland, in terms of pharmacy, are very different from what they are in Northern Ireland, and differences in policies and practices. For example, in Estonia, they only have 2 clinical pharmacists across the entire country. Be aware of miscommunication around terminology, and within pharmacy there are terms like medicines optimization, medicines management, pharmaceutical care and clinical pharmacy, and sometimes those can mean different things to different people, so be very aware of that. And again, be all over the portal. If you've got a partner who is really, really skilled and at the minutiae of this portal, that is excellent, but please do your legwork around that. That can't be overemphasized. So what about money, money, money? I suppose the biggest learning point here is get your local finance team in on the act at day one, at beginning. Don't leave it to the 11th hour. Make sure you're aware of what the maximum funding is, and indeed what the funding level is, because some types of European funding do not fund 100% for every organisation. Maybe if you're a commercial organisation, it may be less than that. Find out what costs are eligible for reimbursement. So an example would be a cost action where the research itself is not funded, just the networking. So the budget is largely built around the building block of per person months, and there's more than one way to skin a cat, and there's more than one way to calculate per person months. So be aware of that. Also, there can be negotiation within the consortium, maybe a bit of horse trading, particularly towards the end of the time. But be realistic and be very practical, because like time, the budget can absolutely run away whenever you get into the actual implementation of the project. So what about the grant agreement and signing? Well, I suppose the biggest learning here for us is the terminology around this, and it can seem like gobbledygook. There's LEARs, F signs, L signs, P COCOs, TMEs, and all the rest. So be aware of the complexity around even the terminology and the roles within your organisation that need to be allocated. And that was very complex, and we find that difficult within MOIC because that was very new for us. And those roles can't just be allocated overnight. So for example, the LEAR takes a lot of administration around that, and even at the proposal writing stage, be identifying who the LEAR is and be linking with them, and that's the local entity appointed representative, and that's absolutely critical for good governance of these grants. So I thought it would be good to tell you our unsuccessful stories, first of all, because we absolutely don't know everything about this. Every day is a learning day. So we've had a couple of grants that have taken a lot of work, but have been unsuccessful. But the key learning here is that turn that into success, keep going, get the feedback, look at the feedback, keep connecting with your partners, and then resubmit whenever you've dealt with the feedback, or if it's more appropriate, perhaps to repurpose that for another grant. So keep going and keep the energy and the momentum going. We've had a lot of successes, thankfully, in Horizon 2020. We have had a sympathy success. We have Interreg success also through an iSympathy medicine review project, and another Horizon 2020 success that's currently ongoing called Shapes. And if you're interested in learning a little bit more about Shapes, which is around supporting older people to live well at home through enabling technology and platforms. So where are we in MOIC now? Well, I'm pleased to say that we successfully submitted our first Horizon Europe application on the 21st of September, and that's a date that was ingrained in my brain. So that was a MedSafe proposal. So we're really optimistic about that, but I have to say it's been a steep learning curve, and we're very interested in a number of other calls that are coming up with a deadline in April. So we're working hard towards that deadline. So what are the top tips? The first thing is to absolutely draw on the experience of others. Every day is a learning day, and people within research and innovation are really helpful. So go and ask somebody, come and ask us in MOIC. Use the expertise of people like Patricia, who is invaluable and is a fount of all knowledge. Make sure you're realistic, that you start small. So for example, in MOIC, there's not a mission that we would have started off leading a whole proposal. We started contributing to work packages, and then in our most recent proposal we're actually leading one of the key work packages. So make sure you're realistic. It's very competitive, and if you notice some of the slides that Katie shared, the first speaker, some of the success is very small. Some of the grants are only maybe funding one proposal, some are funding 10, and I think in our Horizon Europe proposal there are only 5 of those being funded, so it's highly competitive. But don't be put off by that. My motto in life is, if you're not in, you can't win, and really go for it. Sometimes you will have a really good proposal, you'll score highly, but you'll not be funded. Turn that around and go forward with your partners that you're building, and absolutely go for it. So I hope you find that helpful, a very practical run through of some of our learning over the past number of years. And please do get in touch with us in MOIC. We'd love to link with you. And what I'd like to do is just leave you with a final thought. So with that, I'll hand back to Patricia, and thank you everyone for listening.
Thank you so much, Anita. That was really very, very interesting, and I have to say inspiring. So thank you very much indeed. So we've kept really very nicely to time, despite a slight late start. But we're now on our Q&A session. So I'd like to invite the 4 speakers that have gone before to switch on their cameras, if you like. So that would be Katie, Jo, Kay, and Anita. We don't have too many questions, so if anybody has any further, please add them to the chat box, or to the Q&A box, sorry. But there was one regarding UK association to Horizon Europe, and that has been answered sort of already. A message has been typed in to the Q&A box, so people can read that at their leisure. And there is the link to the Q&A document on UK association. So are we okay to leave that one? Katie, are you happy with that?
Yeah, I don't have anything to add to what's in the box already.
That's great, thank you. So there was a message in the chat box regarding the cancer mission, which I'm now going to try and find. It's gone off my screen, but just give me a second here. So regarding the EU cancer mission, we are waiting for the launch of the missions in full implementation phase. Are there any suggestions when the calls would be released? So Katie, could you answer that one?
We do expect that the work programmes for the mission on cancer are released later this year. So for the 2021 to 2023 time period, it will be €378 million available across the mission, and we expect work programmes to first come out later this year.
I just wondered, do Kay or Martha have any extra update on the timing of the updated work programmes, or?
No, there's a draft available, and the cancer mission is being, or all of the missions are being developed through the strategic program committee. But there is a draft available with a number of calls at the moment. Do you want to add anything, Martha?
No, it's just not publicly available yet. So it's the NCPs might have a copy of it, but we don't have an exact date. So that's where we are at the moment. But it is anticipated to be later on this year, because the call closing date is quite tight. It'll be April to align up with the call closing for the main health programme.
Okay, thank you. We'll hopefully see some information on that soon then, and we'll disseminate it as soon as it's available. For Anita, there was a question regarding, can you provide a list of the facilitation or grant writing companies? So I don't know if you want to follow up with that, or if you have any verbal, do you have any lists?
We can do. We have experience of working with one of those companies over a couple of grants, and certainly I can share that that connection with the individuals. Yeah, I can absolutely do that.
Okay, thanks, Anita. And your contact details were on your slides, I believe, and those will be shared with the group. So that's a way of getting in touch with you then. And we have another question for Anita. Having submitted for both Horizon 2020 and Horizon Europe proposals, have there been any significant differences between the two? So I guess Kay already covered some of the novelties, but just are there any changes that you noticed when you were preparing your proposal?
I suppose some of the information that's already been shared about the gender aspects and so on, that we had to do a little bit of legwork around, and I suppose for us that was probably the key one. And I suppose it brings us back to really doing the legwork about the spec of these grants, and what the minutiae is, and making sure that all of the different partners are aligning to that. I suppose the other benefit of Horizon Europe is that a lot of the sections have been reduced, but that, I suppose, in many ways could be a pro, but it can also be a con, because sometimes it's harder to write something in 2 pages than it is to write it in 40 pages. So just be aware of tips like that.
Thank you, Anita. Thank you. And do any of the NCPs have anything to add regarding that? Significant differences between Horizon 2020 and Horizon Europe?
I might add something, Patricia, if that's okay.
Please go ahead.
So one of the new changes in the ethics side as well is you're asked about whether you have used AI or artificial intelligence in your approach to research, because this is now applied in quite a few topics in the health area, and you need to address this in your ethics section. And they also make reference to the new proposed legislation on AI, so you need to become aware of that legislation, because even though it's not legal right now, it will very likely become legal in the duration of your project. So you need to understand, the ethics around ethical AI, non-bias and trustworthy AI, and all of those kind of aspects as well. So that's something to bear in mind if this is your area. That's it.
Very much. Thank you, Martha. Martha will be speaking just after the break on the Innovative Health Initiative, but she's the Irish NCP for Health, based on Enterprise Ireland. There was another question in there about the £5,000 pump priming provided by British Academy. Joe, you're typing an answer to that, or maybe you already have?
So I've put answer, I'll just add a bit to it in a second as well. I've included a link to the call webpage. I've also included a link to a LinkedIn article I did. And in the chat for that, I've included some extra clarifications we got from the British Academy. I'll copy those across to the Q&A in a second. But the British Academy, who are running the call, have confirmed that as well as working with EU countries, you can also work with associated countries, with the US for health, with Switzerland if they've got their own funding, and with low and middle income countries. So basically you can use this funding to work on preparing for future proposals that you intend to submit, and it can be used to fund both UK organisations and organisations in countries that are eligible to be part of the consortia that you're working with. If you've got any more detailed questions as well, on the call webpage, on the left, there's a contact at the British Academy. The British Academy are doing the admin for this call, but it's funded by the UK government, and it's been jointly launched by UKRI and various other organisations, but the British Academy are collecting the proposals and doing the peer review on behalf of everyone. So hopefully that's helpful.
That's very helpful, thank you, Jo. I'll close up the Q&A now. I will direct people to the chat, because there's some nice useful information there about various supports, and I see there's some information on Intertrade Ireland support schemes, again, to build consortia. But we'll leave it there. We will take a 5-minute break. We'll come back at 11:21 if I'm going to be precise. So just give everyone opportunity to go grab a cup of tea or coffee, and we'll see you back in 5 minutes. So thank you very much indeed.
Thank you.
The Innovative Health Initiative. The Innovative Health Initiative is a follow-on from IMI, the predecessor, which pretty much involved FPIA as the public or the private organisations, the pharmaceutical industries. So this new entity is much, much broader in scope, bringing in 5 different industry groups from various different sectors. And so it's funded by 1.2 billion pot from the health programme, which moves across into this public-private partnership. And there's a 1.2 billion contribution going to be made by industry. Okay, so these particular industry groups will contribute by benefiting kind, basically resourcing projects and their existing infrastructures. Some of the very large ones will not be taking money from the pot, but basically some of the smaller ones will, depending on the projects. And there's a certain threshold where basically when the company is so large, they will not take money from the pot. So this is a much broader program of activities than the Innovative Medicines Initiative. It will look at pharmaceutical development, diagnostics, medical devices, imaging, biotech, and digital industries. The program is anticipated to launch in the first quarter of 2022. You can find more details on this website, EU Health PPP, and also a worthwhile document to review is the strategic research agenda, and I'm going to talk a little bit more about what is included in that. So these are the industry groups that are involved. All of these will have, they have multiple member organizations as members and associated members. So you're bringing together a huge range of technology companies into this program. So where are we? Okay, so the Innovative Health Initiative is actually going to be structured as a joint undertaking or public-private partnership under the Horizon Europe programme. Now this, the legislation around this comes under what they call an Article 187. Now as we moved into Horizon Europe, many of the existing partnerships were reviewed. There was justification put forward as to why they wanted to go. There was an impact assessment, and basically there was a streamlining of the partnerships that were involved. And one of the key changes in Horizon Europe is that all new partnerships will come under what they call a single basic act. And this will be dictate the governing, structuring, the role and functioning of each particular program. Now this single basic act is a whopping 500 pages of text and legislation, but essentially it will dictate the governance of this entire suite of partnerships. So the key focus of the Innovative Health Initiative is to pioneer healthcare innovation all the way along the healthcare continuum. The programme itself will align up with the main health programme, the European Beaten Cancer Plan, the Cancer Mission, the Industry Strategy for Europe, the European Pharmaceutical Strategy. So the activities will focus on primarily 5 different areas: diagnostics, drugs, devices, delivery, and data. What is really unique in this as well is there's going to be a big focus on healthcare and healthcare systems, and also there's going to be a big emphasis on the engagements of citizens and patients, which will be the center of many of the projects, and patient engagement will be encouraged in most projects. So just to highlight, I suppose the main document to look at and review at the moment is on this website. It's the Strategic Research Agenda. That'll give you a very good insight as to what their objectives are. I'm going to go through some of them now. And then basically, they have a presentation on the structure of IHI itself. So the key objectives of the Innovative Health Initiative is to focus on large-scale, 30 large-scale projects across the area of health. And one of the things that they've also said is that they want to come up with 5 really strong examples of where they've integrated healthcare products and services into the healthcare system. So there's a big focus on that in this particular program. And also this will align with the European Beating Cancer Plan. The other thing that they want to look at is the industry strategy for Europe and delivery on the European Pharmaceutical Strategy for Europe. So to take a look at the 5 different objectives, the main objectives of the program, you have the first one is better understanding of the determinants of health, priorities, and diseases. And I'll give you an example of these in a second. Second one is integration of fragmented healthcare research and innovative efforts. And then it's development of people-centric integrated healthcare solutions. So this is the patient engagement side of things. Full use of digitalization and data exchange in healthcare. And 5 is the assessment of added value and innovative and integrated healthcare solutions. So this particular table, there's a lot of details in it, but essentially if you take each one of these objectives, you start to understand what they're looking for in terms of outcomes or outputs. So you're understanding health, biomarkers, diagnostics, prognosis tools, wearable devices, the application of artificial intelligence, computer modeling, sensory technology, monitoring infectious disease outbreaks, and improving vaccines. So that's the activities for the first objective. For the second one, it's integration of healthcare, improved medical imaging, analytical tools, clinical trials, solutions, and home care, innovation in the area of manufacturing, such as 3D printing and mRNA technology. Under the third objective, which is demonstrating the feasibility of people-centered integrated care solutions, you're looking at the integration of healthcare solutions, patient engagement, looking at the PROMs and PREMs in terms of patient care, tools for communication so that there's communication both ways in terms of patient and healthcare, proactive healthcare management, digital health literacy. So all activities will focus on these particular outputs. Exploiting the potential of digitalization and data exchange in healthcare. So basically what we're looking at here is data standards, data banks, medical devices, wearable technology, all of these complying with GDPR, electronic health records, and deployment and use of new AI-based applications. Under the fifth objective, they will be developing new and improved methodologies, models for assessment of added value, innovation, and integrated care solutions. So this is looking at new and improved methods and tools, the use of real-world data, analytical methods, improving healthcare and healthcare outcomes, improving the implementation of innovative technology in healthcare settings, and essentially the adoption of new technology. So you're bringing together all of these big industrial partners. So in terms of technology. They want like imaging devices, new kind of remote care facilities. They're the classic examples of what they're trying to do, but they're going to be doing this on a very large scale. So just in terms of timeline and what we're looking at, the adoption of the Single Basic Act, that is going through its final stages, and it looks like that will be completed by the end of November. And basically, all of the partnerships will be ready to go following that. The early stage kind of engagement then for 2022 will be with the likes of the strategic group and the coordinator groups. So basically they'll be looking at a final strategic research agenda with their plans and activities for the first 12 months or 2 years, and then there will be a launch call. At the moment, we don't have any precise details. We're pretty much looking at dates into January, February and March, but we haven't had a whole lot of communication because the Single Basic Act has been the primary roadblocker in moving forward. So in terms then of just keeping up to dates on the activities, I do recommend you sign up for the newsletter. As I said, the Innovative Medicines Initiative is the predecessor. They do very good newsletters, and this particular group will move forward onto the Innovative Health Initiative. But what they do is they highlight a lot of the upcoming activities. They do webinars. They highlight successful projects from the past. So it's a very, very useful resource to sign up for that there. The other thing is our national newsletter as well. If you wish to sign up for that, just sign up on our health page and ensure you sign up for the health related newsletter, and we will keep you up to date on the new activities that come out of that. So this is my contact details if anyone wishes to contact me, and I will leave it there. If anyone has any questions, I'm happy to take them in the Q&A section.
Thank you, Martha. Thanks very much. Martha, I think I would like to point out as well that associated countries will be eligible to participate in.
Yes, yeah. So at the moment we haven't had any updates on that. So we're just waiting for the association. So exactly like that, all associated countries will be participating in the exact same way that they will participate in Horizon Europe.
That's lovely. Thanks very much, Martha. I suppose I'll just put a wee shout out there that we have a successful Innovative Medicines Initiative project ongoing in Northern Ireland. It's called IABC. That was funded just at the end of FP7, actually. Just throwing that one out there, that it is possible to win these grants.
Yeah.
I think Queen's was coordinator of that particular project, and it's gone very well. But thank you very much, Martha.
You're welcome.
That was a really interesting talk. And we'll pick up the Q&A just after the next talk. So Claire Griffin from InvestNI is going to speak about the European Innovation Council funding. Claire's based at InvestNI and she's the NCP for SMEs. So thank you very much, Claire. Claire, we are seeing your notes again, if you're happy enough with that, but it's just to alert you to it.
Sorry, Patricia.
No problem.
Technology is really failing for me today. While I'm sharing my screen, I will maybe just start with an apology. I have a bit of a cough today. I will keep my cursor hovering over the mute button, and I really hope I get there in time. So I do apologize.
Hope you're okay. That's perfect now. See your slides well now.
That's great. Thank you very much.
Thank you.
So, good morning. Thank you very much. It's great to be here to speak to you all today. I've really enjoyed the presentations we've had so far. I would like to take a few minutes to speak to you about a particularly niche area of Horizon Europe called the European Innovation Council. My name is Claire Griffin and I'm based in InvestNI, but I am one of the UK's NCPs for SMEs within Horizon Europe. So we've already seen this structure this morning from Katie. You've heard our colleagues speak already on Pillar 2. I'm speaking to you on Pillar 3, Innovative Europe. There's 13 billion money available within Pillar 3. And I'm going to speak specifically on the European Innovation Council. So what is the EIC? What is the European Innovation Council? It is support to innovations with breakthrough and market creating potential, and there's over 10 billion available to do that. So the EIC is backing visionary entrepreneurs. It's a 10 billion program to identify, develop and scale up breakthrough technologies and disruptive innovations in Europe. It combines research on these emerging technologies with an accelerator for startups, SMEs and scale-ups. There are three main funding instruments that I'm going to talk to you about today. It is a proactive approach with flexible funding. We are currently working from a one-year work program for 2021, but 2022 is in draft, and I will mention that again as I progress through my presentation. So the three main instruments and some of their characteristics. We have the EIC Pathfinder. We heard from Joe and Katie that different areas of Horizon Europe, old habits die very hard. The Pathfinder is 100% funded. It is focusing on early stage research with breakthrough technologies. There is a grant of up to 4 million. And if you're familiar with some of the terminology from Horizon 2020, this is a successor to FET, which was Future and Enabling Technologies. There's then the Transition, which is also 100% funded, and it is focusing on technology maturation from proof of concept to validation. It's looking at business and market readiness, and there's grants up to 2.5 million. The EIC Accelerator is not 100% funded, it is 70% funded, and it's really focusing on the development and scale up of deep tech, disruptive innovations by startups or SMEs. It's blended finance, and I will talk about what that means for UK participants in a couple of slides' time. But grants range from 500,000 to 2.5 million, and there is an equity component of up to 15 million. So within Horizon Europe, and indeed also within Horizon 2020, we talk about TRLs, technology readiness levels. Now I have this slide in front of me, I can see what I have down the right-hand side doesn't track exactly to what's down the left-hand side. So before I circulate a copy of this presentation, I'll flip that round so it makes more sense and easier to read. So the idea of the EIC is to move projects along the TRL, where TRL 1 is your basic research, so the Pathfinder would cover TRL 1 to 4. So you're moving from your basic research really through to proving the feasibility. The Transition, you're taking your proven feasibility and you're moving through your R&D, you're moving through your technology development, which then in theory brings you to the Accelerator. So you've demonstrated your technology in a relevant environment, you're continuing to develop the system, and then TRL 9 is launch, because the Commission nicked TRL from NASA. So the call dates for 2021, I know that you are looking at this slide going, Claire, there's only one call open and it's only Pathfinder. It closes at the end of the month. I mentioned before that we are working from a one-year work program, and the 2022 work program is in draft. I'm not a betting woman, but if I was, I would be fairly confident that the dates would mirror the rough times of year that we've seen in 2021. So for the Pathfinder, you're probably looking at a May for open calls and October for challenge calls. And again, the Transition had September deadlines for both. I'll come on in a couple of slides what open and challenge means for each of the individual calls. The Accelerator, we had there's two different types of applications. There's a short application and a full application. We had two deadlines this year, June and October. I would suspect for 2022, we will go back to mirroring how it looked in Horizon 2020, and we will have 4 deadlines for the Accelerator in 2022. I'm sorry, my slides are really slow to move forwards today. So the focus of the EIC Pathfinder is to turn excellent science into breakthrough technology. It's to prepare industry for leadership in future technologies and to support competitiveness by providing radically new tech ideas. The open call, we know it's already closed. I did get the irony in explaining that to you. So basically, I've already explained it's TRL 1 to 4, it's collaborative research. So Joe explained what that meant. So that's 3 member states or associated countries. It's bottom up and interdisciplinary. So you tell the Commission what problem you're solving. The expected outcome is proof of principle. That tracks back to TRL 4. It's a 17 per page proposal. And if you are funded when you've finished the Pathfinder, you can fast track onto the accelerator or 50K in complementary activities. I know this is a lot of information. I am really open to questions, and if anybody wants to follow up with me afterwards, I'm happy with that as well. The Pathfinder challenges, really the aim of them is to build new cutting edge directions, new opportunities for innovative technological solutions. The deadline is the end of October. There are 5 challenges, so awareness inside, tools to measure and stimulate activity in brain tissue, emerging technologies in cell and gene therapy, new routes to green hydrogen production, and engineered living materials. So the transition, it was new for 2021. We're focusing on breakthrough technologies and disruptive innovations. So we're moving you from TRL 3 to TRL 5 or 6. There are open and challenge calls in relation to the transition as well. The open is nearly 60 million, and the challenges, there's a budget of 40 million. So we are talking for challenges, medical technology and devices, which is looking at taking you from lab to patient, and we're looking at energy harvesting and storage technologies. So it grants 100% up to 2.5 million. They do talk about possibly larger amounts if properly justified. I personally think that makes it more interesting for health projects where there's the potential for clinical trials. Happy to talk about that to you offline if required. Who can apply to the transition? It's a single legal entity in a member state or associated country. So you can be an SME or a research performing organisation. Larger companies aren't eligible. And you can also be a small consortium of 2 to 5 independent legal entities. In 2021, there are restricted applications. So you have to have been previously funded under a Pathfinder, an FET call, or an ERNet, or ERC proof of concept project. We haven't particularly talked about ERC this morning. It's underneath Pillar 1, if you go back to my original diagram. So the transition is beyond proof of principle, It funds innovation activities beyond experimental proof of principle. It's aimed at maturing your technology and your business idea and increasing your technology and market readiness. At the end of the project, you should be ready to apply for the accelerator, and you can go in again through the fast track scheme. You should be seeking other investors and other sources of funding. You're willing to enter licensing or collaboration agreements with third parties, or you have another alternative route to market. There's also an ad hoc grant associated with transition, and there's up to 50K associated with that. So what does the accelerator offer? Agile funding, innovative projects ready to scale up, TRL 5 to 6 and above, and for 2021, the budget was 1.1 billion. In addition to the budget, you get access to an ecosystem within the European Commission. So it's access to coaches, mentors and experts, guidance of EIC program managers, and crowding in of other private investors. The 2 cutoff dates this year were June and October, and I suspect there will be 4 cutoff dates next year. Likely January, April, June and October, simply because that mirrors what happened in 2020. Happy to be told I'm wrong. What will the accelerator fund? High-risk potential innovation projects, projects with potential to create new markets or disrupt existing ones, projects that build on scientific discovery or technological breakthrough, and projects that require significant funding over a long time frame before returns can be generated. And we talk about this as the patient capital principle. So who can apply to the accelerator? So I'm on a beneficiary scheme. So you either have to be an SME, which goes by the EU definition of SMEs. So that's a maximum of 250 employees, not subsidiary or majority owned large companies. Small mid-caps can apply for rapid scale up and investment component only. That excludes UK companies, and I will talk on about that in a moment or two, and natural persons willing to set up an SME. What support can UK beneficiaries receive? I have said before, as did Katie actually at the beginning of our session this morning, there is an investment component. It is not open to UK beneficiaries. In case anybody on the call is not UK, the investment component is, sorry, I have the X in the wrong place, up to 15 million. It's in the form of direct equity or quasi-equity. You're maximum expected to give away 25% of the voting shares in the company, and the patient capital principle, we're talking about 7 to 10 years perspective on average. So from a grant component for UK companies, maximum 2.5 million euros. Eligible costs are reimbursed up to a maximum of 70%. All your innovation activities should be completed within 24 months. So there are 4 different types of funding that is available within the accelerator. So we have grant and investment, grant only, grant first, and investment only. UK companies can only apply for grant only, and that means that you need to prove alternative sufficient financial means for deployment and scale up. So I said before, the accelerator will take you from 5 or 6 to TRL 8. So you need to have the funding to take you from TRL 8 to TRL 9. That's the summary of the previous slides. So in the accelerator, there are also open and challenge calls. You need to pick one. You cannot apply for both at the same time. If you're not entirely sure that your innovative idea meets the challenge call, my advice would be apply to the open call. Happy to have a conversation about that with you. Green Deal challenge priorities are there if you have interest. These are the challenge priorities for the digital and health technologies. So you can see it's covering a number of the same topics that we've already heard about this morning: advanced high performance computing, edge computing, quantum technologies, cybersecurity, artificial intelligence, blockchain, cloud infrastructure technologies, Internet of Things, and then diagnostics, gene cell therapy, biomarkers, bioprocessing, and e-health. So I'm not expecting you to read this slide. I know it's very small. It's full of hyperlinks that if you are interested in the transition calls are there for you to access, and there are some contact details down at the bottom. Innovate UK Edge used to be called Enterprise Europe Network and are still part of the wider Enterprise Europe Network scheme. I know my Northern Ireland colleague from Innovate UK Edge, Debbie Vance, is on the call this morning. She put in the chat, she'd be happy to chat to anybody about finding partners as well. There's the same further info page for the accelerator. One thing to note, Joe's already mentioned touched on this, the Commission will not fund anything that is funded before. So as an applicant, you are responsible for making sure that what you're proposing hasn't already been funded. So this is Cordis, this hyperlink. Joe's taken us through that, and you need to research what has already been funded under the accelerator. There's my contact details. If you have any questions, happy to take them, or happy to take them at a later date. Thanks very much, Patricia.
Thank you, Claire.
And I realised I hadn't turned my camera on that whole time, so I do apologise. I am here.
That's good, Claire. Thanks very much. And I'm glad your throat survived as well. Claire and Martha, we've got a small Q&A session assigned for both of your talks, but I actually don't see any questions in the Q&A box at the moment.
May I ask, or just add a comment there, just to onto Claire's presentation? I interact quite a lot with my EIC colleagues on our side, and I suppose in a sense you're crossing over with the type of clients that go into either program. One thing you didn't mention, Claire, maybe was the Pathfinder Challenge guides are very important. If you have, say, for example, the topics that are there for that are closing on the 27th of October in, say, gene and stem cell therapy, there's actually a document on the portal that actually gives you much more detail on what is included in gene and stem cell therapies. So you need to read those program guides on the portal as well. So it's just a lot more detail in terms of the topics. Yeah, it's very useful.
Apologies, and thank you for highlighting that, Martha. Completely agree. Please read them. And again, like yourself, Martha, I'd be happy to chat to colleagues about that, and I'm sure you would as well.
Yeah.
That's fantastic. Thank you. Just a quick question from me on EIC, and Claire, do you know when the 2022 work programme might be available then, when you can see some of these deadlines?
You would really hope it would be soon, wouldn't it, when we're talking about the potential of a January call? I haven't seen any dates, Patricia, but it absolutely needs to be before the end of the year. I'm sorry, that's all I know.
Tricky question. And I just have a little question for Martha on the Innovative Health Initiative. So my perception of Innovative Medicines Initiative, which was the precursor programme, was that the topics were a wee bit more defined than they are within the health cluster. And I guess we would expect that going forward. What I mean is that the topics within health are quite broadly defined, but Innovative Health Initiative, I would imagine there'd be a bit more specifics on the type of research that's going to be funded.
Yeah, so there's a few challenges on that side. So when you have the Innovative Medicines Initiative, what you had was generally quite large projects, and the process itself was months and months long, right? They were fairly mammoth tasks in terms of how they were done, and there was always a two-stage process. So people would, the academics and maybe the SMEs would all get together, form a consortium and put in an application, and then there's a brokerage kind of with the pharmaceutical companies, and then you would submit a final application that got approved. Now, because you have many different types of entities participating in this, such as medtech companies and diagnostics, that timeline to getting a grant approval is very, very long for those type of industries, because they are much more nimble, they move faster, they progress faster. So this two-stage process was discussed as something that was not really going to work, because the project would already be done, by the time they would get approval. So there's going to be one stage and two-stage process calls, and there will be small kind of grants and then big grants and stuff like that. But we have had no detail yet. We don't have a detailed work program, so it's hard to say. But I know there was a lot of discussions about the need to be much more nimble given the nature of the new industry group that is there. So I think it will reveal itself when we start to see drafts of the work program and topics coming forward. But I think it'll be a different type of work program than the previous one. So again, happy to brief you at some stage in the new year when we get more detail, but right now we don't have enough details. And us as member states representatives, we haven't had a meeting in a long time because we're waiting on the legislation, so to be approved. So that's
okay. Martha, thanks very much for that insight. That's really helpful. And I guess that you probably run an event even as yourselves as the Irish NCPs. And
so yeah, and again, we have had no timeline on when activities are going to take off and nothing to promote just yet. So it really is, we can just outline the skeleton of what we have right now. So yeah, but we'll let you know.
Thanks.
Cheers.
Thanks so much, Martha. Thanks, Martha and Claire. We'll just close that session then. Really appreciate your time today.
Thank you.
And so I thought I would try something a little bit different at this Horizon Europe event. I thought it could be really nice to have some pitches from local researchers where they could highlight their own expertise and their interests in Horizon Europe. And we've got 5 individuals, 5 organisations volunteering to come forward and do that. So very quick fire pitches, 3 minutes or so per person. I invite Myra Parr from Axial 3D to give the first pitch, please, Myra, to the community. And thank you very much. I'll let you share your screen and microphone off. Okay, thanks, Martha. Or thanks, Myra, sorry.
Okay, great. So yeah, hi everyone. So I'm part of Axial 3D. So we're a medical imaging technology company based in Belfast. And really the problem we're trying to solve is that 2-dimensional medical scans, such as CT and MRI, they're used to visualize anatomy, which is in 3 dimensions. And, you know, and 3D anatomy is quite hard to visualize with these 2D images. And this can lead to misdiagnosis or poor surgical planning. So there is software out there that allows you to convert this 2D medical image into a 3D visualization of the anatomy. But with current software, it's quite a slow and manual process. You need to purchase an expensive software license. It requires specialist expertise. So really our solution to this problem, and where our research expertise comes in, is in the development of machine learning algorithms that automatically turn this hard to understand 2D medical scan into a precise 3D visualization of anatomy to ultimately really improve decision making. So we create digital 3D images as well as 3D printed models, which are physical models. We cover a wide range of specialities, from orthopedics to neurosurgery to cardiology. So really why I think Axial 3D would be a valuable partner in your project or your consortium is that we have, like I said, quite a strong team with expertise in machine learning to create these 3D visualizations of anatomy from 2D medical scans, so automatically at low cost and ultimately without the need for specialist expertise. And we also have, you know, really strong expertise in 3D printing of anatomical structures from 2D medical scans. Furthermore, we have a lot of customers, so 300 hospitals in over 24 countries use our models and images. So we have a really strong clinical network which can be tapped into for a project. So that's kind of really our research expertise. I just have my contact details there, a link to our website and our socials. And yeah, I think this will be shared after the event, but yeah, please do feel free to get in touch with me if you think Axial 3D would be of benefit to your project. Well, thank you.
That's great. Thanks very much, Myra. I'll move on swiftly then to Glenda Fleming from MOIC.
Thank you.
Okay, Glenda.
Oh. Sorry, bear with me, my presentation's on the last slide instead of the first.
No problem at all.
Okay, so hopefully you can see that now, and it started at the first slide. So a lot of this echoes what Anita has already said earlier in today. So we are based up in the Northern Trust at Antrim Area Hospital, and we're the Medicines Optimisation Innovation Centre. And really, medicines optimisation is a person-centred approach to safe and effective use of medicines, and that's what we specialise in. So by that, we mean everything to do with medicines, right from how they're procured, how they're prescribed, a lot around patient factors related to things like compliance and adherence. And also we have a big focus on the use of skill mix in medicines use. So how can you optimize the skills of the team involved in medicines to make sure that the right person is getting the right drug at the right time? We're slightly different to maybe some other organisations in that we would use a range of methodologies. So we will do research, but also we will do service development and smaller quality improvement projects. So that means some of our projects are very, very small proof of concept, but we'll work right up to that high level European grant funded level. In terms of our team and our skill sets, then we have a broad range of expertise within the team, and that includes both the clinical experience, but also a team of programme managers who are all trained to PhD level. So why would we be a valuable partner? Well, we're actually the only dedicated medicines optimization centre in Europe. But given our placement within a health service setting, that gives us a little extra uniqueness there. Probably the biggest thing, and I think this came across in Anita's presentation, is that we do have a wide network of people and partners that we work with, and this includes companies, academia, the pharmaceutical industry, charities. Obviously, as I've already said, we have our own staff with that broad range of experience and expertise. We have the local networks, so whilst we have a strong pharmacy connection, obviously we also link with other health service and social care professionals from across Northern Ireland. We have the range of expertise and memorandum of understanding with partners from Europe, and we're recognised in things like the EIP-AHA and as a SILIC centre. And as I say, we have a range of experience of working across a range of projects, including that success at European level. So in terms of our actual grants at the moment, we have just put in an application in September there, and that one was entitled Harmonising Patient-Centred Medication Safety. We're very interested in the call that's closing in April 2022, and that's on the existing prescription drugs for major diseases. And we're also exploring other options under Europe, including the cost and twinning. So like the other speakers, there's our contact details, and if you want to give us a shout, please do so.
Thank you, Glenda. That was great. Thanks very much indeed. And Sorcha Finnegan is from the Public Health Agency is now going to share a few slides on that research, on that experience that exists within the Public Health Agency.
Great. Can you see the screen okay there?
Yep, we can indeed. I don't know if you want to change to presentation mode, but we can see the slides anyway.
Okay, so the HSE R&D division, really for anyone who's not familiar with who we are responsible for the administration and the coordination of the HSE R&D budget on behalf of the Department of Health. We support research and researchers in Northern Ireland, and we have regional responsibility for research governance and ensuring that policy compliance in health and social care research. We support research and researchers by a variety of ways, which includes funding essential research infrastructure, such as data banks, tissue banks, clinical research facilities and clinical trial units and research networks. We also focus on building research capacity throughout Northern Ireland through creating research opportunities and creating funding opportunities both within the UK and on a wider basis throughout Europe. We support innovation, and we also ensure that patients and the public are involved in health and social care related research. This just gives an overview of the capability map of health and social care research in Northern Ireland, and you can see the HSE R&D division up in the right hand corner there. There's a lot of organisations in Northern Ireland involved in HSE related research, and we have strong links with both academia, industry and the health sector.
and we have strong links with stakeholders across all of these sectors, and that includes academics, clinicians, allied health professionals, policy representatives, and patient groups. And so the topics really that we would be interested in collaborating on within the R&D division would be focused on policy and governance mainly. So I've listed 3 particular areas there that we would be interested in. And one is the roadmap for personalised prevention. Another that we'd be interested in is the European partnership fostering a European research area for health research, and then the Destination 6, which is maintaining an innovative, sustainable and globally competitive health industry. Our contact details are there, and myself and Janice, who is the Assistant Director for R&D, would be happy to take any contact from anyone who would like to get in touch with us.
Fantastic. Thank you very much, Sarah. Thank you so much. And our 4th speaker is Donica Hanna from Queen's, from the School of Psychology. So Donica, if you're ready to share your slides, please go ahead.
That's great, thank you. So now for something completely different. My name is Donica Hanna. I'm a reader in mental health from the School of Psychology, Queen's University, Belfast. And my research expertise is really all around the measurement and modelling of mental health and well-being. So I'm interested in a wide range of mental health constructs. A lot of my previous work has been on psychological trauma and also those people at risk of developing mental health conditions. I'm interested in how mental health relates to a range of outcomes, including physical health and exercise, socioeconomic status, and a range of biological and social markers. A lot of my research focus is around risk and resilience factors. So we know that not everyone that has the same experiences will have the same mental health or well-being. So I'm interested in what sort of biopsychosocial factors put people at risk, but also, really importantly, what are the main protective factors that foster resilience and well-being? I have research expertise in a range of research methodologies and research design, and also quantitative data analysis. And I have I've written books, best-selling books in both these areas. Sorry, my screen's quite funny. Why would I be a valuable partner? What a good question. Well, I think I have a high publication rate from the projects that I've completed. All the projects I've completed have been on budget and within time. And that's with working with different partners, for example, all the trusts across Northern Ireland or a range of international partners. I've experience of leading projects with a range of methodologies, including experimental projects. So for example, at the moment, I have developed a mobile phone app and I'm collecting digital phenotyping data, which I'm hoping to link back to mental health constructs. And I'm also running 2 projects using eye tracking and virtual reality. I have led Delphi studies where we try to develop consensus across a series of guidelines or principles from a panel of international experts. Working with large data sets, this can be secondary data, can be data linkage studies, or collecting new data and analysing it and trying to make sense of that data. And also systematic reviews and meta-analysis, where we review the current existing state of the literature and the gaps within. I have a real interest in psychometrics, which is how we measure and ask questions in our surveys and so forth, because often that's not done optimally. And as I've mentioned, I've also have interest in research design and quantitative analysis. In terms of 2022 topics, I feel I most neatly fit into the boosting mental health in Europe in times of change category, but I would like to stress the point that I would be open to all collaborations where I could make a meaningful contribution. And my contact details are available on the slides on the right-hand side. Thank you.
Thank you, Donica. Appreciate that. And last but not least, we have Ronan Flanagan from Numa Innovation. And thank you.
Hello, Patricia. Hello, everybody. Thank you as well, Patricia, for inviting me along. So I'll just share my slides here. Okay. Okay, so everybody can hear me okay. So New Engineering's, we're an engineering services company, and we're based on performing analysis projects and simulation and code development. So we'd actually do projects and actually analysis activities. So especially in the commercial area, we'll partner with other companies and then try to improve their product and support them on that analysis side. But in terms of EU projects or research projects, again, also on a commercial basis, we will work more on the simulation code development, and we'll kind of adapt our codes to a specific application. So, of course, coding and numerical modeling is a broad area. So specifically where we would fit in is that their higher level area of computational fluid dynamics or stress analysis. And in terms of EU projects, that would fit into this here general acronym of virtual human physiology, where you try to bring the computational techniques which were used previously in aerospace and automotive to the human body. And that would include either modeling like how an organ would work in terms of, say, the liver, in terms of the blood flow in the liver, but also in terms of the sort of the biochemistry of the liver itself. So there's a broad range of areas of virtual human physiology, including even probably medical developments in terms of, you know, vaccines, that type of thing. But we would sit on the higher level end of it, more approaching kind of the engineering application of medical devices. We've also got experience in AI techniques for assisting, again, the decision making in these numerical predictions of medical devices. And we've got experience in aerospace, biomedical, and renewable energy. So of course, when you come to modeling, a lot of these techniques move across the different domains. But of course, there's domain-specific issues in all these areas. So why are we a valuable partner? Well, we've experience in 4 large EU projects extending away back to FP7. These are primarily in the area of ablation treatment. So I don't know if anybody's familiar with that type of treatment, but it's a minimally invasive treatment where you use a needle to burn out a tumor. So you can see where we would come into this in terms of predictions of heat transfer. And from these projects, we've been able to take over the commercialization of GoSmart software, which is a cloud-based software environment to help model surgical treatments. So you take the data from the CT scan and you turn it into a virtual 3D model, and then you can add on various simulation solvers to give you a certain outcome, which is then fed back to the clinician. And in terms of AI, that's also where the clinician then will be assisted to make a decision. So it's not replacing the clinician, of course, it's just assisting the clinician. So there may be some techniques, or there may be some projects where GoSmart would fit, or where our own capability in numerical modeling would fit as well. So I've identified just some topics which again, these are broad range in terms of numerical modeling, but there may be something we'd be interested to participate in, both on improving artificial intelligence, on computational models for new patient stratification strategies, and scaling up multi-party computations. Also then there may be other projects which again are outside these actual called topics, which would be AI related or simulation related. For an example, some sort of improved medical devices. And also we'd be also interested in using GoSmart, which is in its pre-commercialization stage, to be used in an RA activity. So you also have my contact details here. And also if you want to have a look at GoSmart, there's a link there as well on the slide. You won't be able to register at the moment. We had it all working as a functional piece of cloud-based software, but various CE marking issues, it's really just reserved now just at the moment until we get into the commercial stage. It's reserved for certain people, but you can certainly have a look around the movies which show the an overview over what can happen in the software, and then also how we can adapt the software to many different types of techniques. Okay, thank you for listening to my talk.
Thank you very much, Ronan. And thank you to the 5 speakers in that quick pitch session. Really appreciate your contribution and putting yourselves forward. So everyone will get a copy of slides after today's event, or all attendees will get a copy of the slides and the recording. So please feel free to get in touch with with the individuals who made their presentations there. So we're going to close today's session with a final presentation from me, where I would like to talk about Horizon Europe funding opportunities under Pillar 1. So the main focus of today was on Pillar 2 and the health cluster, Cluster 1. Katie also referred to other funding opportunities within other clusters of Pillar 2. Then we had the talk on the Innovative Health Initiative, which we know is forthcoming, and Claire Griffin gave a talk on funding opportunities for health under Pillar 3. So now I would like to just have a little quick look at Pillar 1 and really speak to you about the European Research Council and Marie Skłodowska-Curie actions. So Pillar 1 is the excellent science pillar of Horizon Europe, and the European Research Council and Marie Skłodowska-Curie actions, these are bottom-up actions. So the EC is letting the applicants define what the research is that they feel is important, what the research area is, what the research outcomes would be, and basically, as I say, it's a bottom-up. These are both bottom-up calls. So just looking at the European Research Council in a little bit more detail, it's really focused for academics with a strong research profile. The ERC supports curiosity-driven frontier science with a focus on excellence. So the excellence of the applicant and the excellence of the research idea. The applicants need a very strong track record, very strong academic profile, and a groundbreaking idea to be competitive. So as I said already, the schemes are open topic to all disciplines, and the three first schemes listed on this slide are led by a single PI with their research team. I'm not going to go into the details here, but there are a range of schemes for individuals at different career levels. There's two links at the bottom of the screen. The first of those links, how businesses can connect with the brightest minds in Europe. So this is a short blog that was developed by colleagues at UCRO, highlighting how businesses can get involved with ERC projects. The UK NCP for European Research Council is UCRO, and I've got a link to their website on the screen, and you can see the link to the ERC main website at the top of the slide. So the Marie Skłodowska-Curie actions, this is one of the most popular areas with successes across many of institutions and companies in Northern Ireland in Horizon 2020. And again, these schemes under the MSCA support bottom-up actions for skills development, for career development across all disciplines. Research excellence is key, and mobility is key. So mobility of individuals internationally, between sectors, and even in an interdisciplinary level. Marie Skłodowska-Curie actions aim to see strong collaboration of academic organisations with SMEs and industry. So academics and non-academic organisations can get involved equally. I've got a link there to the Horizon Europe Marie Skłodowska-Curie actions webpage. And again, the UK NCP for Marie Curie is UCRO, and I've got a link to their web pages as well. But on this little table, I've just outlined the main schemes under MSCA. We have the doctoral networks in Horizon Europe. They were formerly called Innovative Training Networks in Horizon 2020. Teams can recruit 10 to 15 PhDs. I've got a little asterisk there to highlight the mobility rule that I let you read in your own leisure. So teams can recruit 10 to 15 PhDs, and academic and non-academic collaboration is encouraged. Deadlines for doctoral networks, the 2021 deadline is in a month, and then we've got the 2022 deadline on the 15th of November next year. Postdoctoral fellowships, this is for an individual organisation to recruit a postdoc who will have less than 8 years experience post-PhD. There can be an academic or a non-academic host for the postdoc. and the next deadline for postdoctoral fellowships is the 14th of September next year. Then we also have staff exchanges, we have co-fund, and we have MSCA and citizens. I'll just let you read that at your own pace, or once I circulate the slides after. So then, just to run through some support for applicants to Horizon Europe. We have the NICP network, and I am the NICP for Health. And you can see that there's a whole team of NICPs based here in Northern Ireland. We have Agri-Food, AHSS, Engineering, Energy, and ICT. We also have the SME support provided by InvestNI, Claire Griffin, and we have support for North-South collaboration via Intertrade Ireland, and that's Grania Lennon. And then today you will have heard from the UK NCPs for Health and the Irish NCPs for Health. And again, just shouting out to say, a real strong word of thanks to all of those ladies today. That's their websites and Twitter handles. And of course, you already, when you receive the slides later on this week, you will get, you'll be able to access the links to sign up to their newsletters. InvestNI have the R&D escalator for businesses, just if any companies want to look into that. The EC has run a couple of webinars earlier this year about preparing a successful proposal for Horizon Europe. And don't forget the other aspects of writing your EU proposal. So you can follow the links to access those webinars. Evaluating proposals is a great way of learning what a good proposal looks like and what the important aspects are of a successful Horizon Europe proposal. So this is a call for expressions of interest for expert evaluators. Please feel free to sign up to become an expert evaluator for Horizon Europe. So as I said, Intertrade Ireland supports North-South collaboration on Horizon Europe. Their objective in this space is to increase the number of North-South applications to Horizon Europe. Intertrade supports regular meetings of the All Island Steering Committee. It hosts events, signposting, and develops case studies. And it has a focus on training for Horizon Europe. It also has 2 travel schemes. One of those is to support North-South applicants with travel on the island. And it has an EU voucher supporting North-South applicants to travel off the island and meet collaborators. And as we heard about earlier on in the call, the British Academy has launched a new pump priming fund to support UK-EU consortia building under Pillar 2. So that would be for the Cluster 1 health topics, for example. So it aims to pump prime collaborations between the UK and EU to a call in any of the Pillar 2 clusters. And it's for calls that are open between 1st of September 2021 and the 7th of September 2022. People can apply for up to £5,000 and the awards run until March 2022. All disciplines are supported, and I've just listed some of the eligible costs that could be included within an application to the British Academy. There's more information on the website at the link on the screen, and just listing the forthcoming cut-off dates. They've mentioned 27th of October, 10th of November, and then every 2 weeks thereafter, until the pot runs out, I guess. And already mentioned on the call today was the EC Info Days and the brokerage for Cluster 1. Follow the link on the slide to access information about the Info Day for Cluster 1 on the 20th of October. And then Joe outlined information on the Cluster 1 brokerage event on 29th of October. Registration's open, so please feel free, please go ahead and join the conversation and hopefully get involved in some Horizon Europe proposals. So really, that's the end of the session today. I just wanted to say thank you to all the speakers and to all attendees for joining. As you know, the event's been recorded and the slides and the recording will follow afterwards. And I would just say, please keep in touch with us regarding Horizon Europe.
So I think that's us finished. Thank you very much, and I'll hopefully hear from you soon. Bye-bye.